Good day and welcome to today's Dr. Anyoha's podcast. Today I am going to talk about the challenges that pediatricians face when examining or consulting on 12-month-old babies who are sick. For example, this 12-month-old baby that I saw a couple of days ago, whose mother brought her because she has had fever for a couple of days and that she threw up multiple times, up to about 8 times before the mother brought her to me, and that she was also coughing. She's been coughing for about a week. And of course, trying to find out why a 12-month-old baby girl has vomiting, fever, cough, and irritability is very, very challenging, because some of these 1-year-old, 12-months-old could be very feisty girls. This one happened to be a girl, so she's very feisty, and coupled with the fact that she's been to my office a couple of times, in fact, many, many times, so she tends to associate me with shots and vaccine. So whenever she sees me, she starts screaming. So on top of that, she has cough, fever, runny nose, vomiting, and mother said it's been very hard to stop her from crying. She cries and screams and refuses to eat. So that could be very challenging when the mother brought the child, the 12-month-old. The first thing I did, of course, as a physician, as a pediatrician, is to observe mother and child, observe the child's demeanor, and of course the mother, as the mother tells me the story of what's gone on for the past 1 week. I'm observing the child and the mother. So observation is the first thing I do, and this particular infant was coughing nonstop and screaming and coughing. So it was difficult to actually begin to dissect and to figure out what's going on with 12-month-old who has fever, coughing, and vomiting. It takes experience. It takes arts of medical practice. It takes some skills to actually try to figure out what's going on. So what I did was, the first thing I did was to get the vital signs out of the way. So, and the most important thing I need to do is to find out if the child had fever, or which she had at the time. She had fever of about 102 degrees Fahrenheit. So, and of course, as I was taking the temperature, she was screaming. So it took me some minutes to actually go behind her back and listen to her chest to determine whether she was wheezing or not, whether she was coughing, but is she wheezing? Does she have asthma? Does she have respiratory difficulty? So that's the first thing I want to do. I want to go behind the infant's back, as the mother had her on her shoulders, backing me, so that the child would not see me. Of course, she could probably feel my stethoscope over her chest, back of her chest, but she wouldn't see me. She doesn't see me. She knows I'm there, but it's better she imagines that I'm there than seeing me. So that gave me some minutes, less than a minute, to listen to her chest and determine that she was not wheezing. So because she was not wheezing and she does not have what we call crepitations or rales in her chest examination, I assume that I'm not the one with a case of pneumonia on this child. So what else do I want to know? A child who's vomiting, who has fever, and who is very cranky. I'm thinking about if this kid had some abdominal issues that's making her throw up and also cranky. Infants at this age could have some conditions in the abdomen that could make them throw up many, many times. But I was able to infer from further examination that she doesn't have any abdominal condition, such as what we call intussusception, that could account for her vomiting, I think. And of course, when kids are vomiting, they could have some abdominal discomfort as well from the sheer force of vomiting and the inflammation that takes place when a child is vomiting. They can have some abdominal pains, discomfort, which does not rise to the level of abdominal condition of intestinal twisting, which every doctor, every pediatrician should always have at the back of their mind when they're examining an infant who is vomiting. This child does not have diarrhea, which is important to me. So now I'm dealing with a kid who has cough, fever, cranky, and who I don't think has any serious abdominal condition. So whereas should I look for things that could cause pain in a baby this age? Of course, it's in the ears. So that was my last exam. I had to look into the child's ear. And of course, both of our tympanic membrane were inflamed. They were red, which to me suggests that this child has otitis media, which is middle ear infection, and which I gave the mother a prescription for antibiotics and also gave her something for vomiting as well. And of course, instruct the mother that if the condition fails to improve based on my diagnosis, to quickly call me or take the infant to the emergency room. To recap, trying to figure out what is wrong with a 12-month-old who has fever, cough, vomiting, and unconsolable cry could be very tough and challenging. And it takes the patience of a pediatrician who has seen this kind of scenario before. This differential diagnosis could be ranging from anxiety just because the kid has been there before and remembers you as the pediatrician who gives her shots. In fact, 12-month-old babies could be very, very smart and can tell that you're the person with the vaccines, you're the person with the needles, who gave the needles time in the past. So seeing you is a cause of anxiety for this child. But the most important thing is to be able to rule out, to exclude pathologies in the lungs like pneumonia or wheezing or any other condition that can present as cough and fever. So once you rule that out and you rule out any abdominal condition that could present with vomiting and pain, such as intussusception, then you are looking at ear, nose, and throat as possible sources of child's fever and fussiness. So that's what I did. That's how I unraveled this presentation in this 12-month-old infant. And of course, my prescriptions were the usual amoxicillin 2 times a day for 7 days, Zofran for vomiting, and to educate the parents on what to do should the child continue to be sick or should the condition worsens. Thank you so much for listening. I hope this helps a little bit when next you see a 12-month-old who has been vomiting and having fever. Thank you. Please share this podcast with your friends and family.